Hello, welcome to this tutorial on our 2023 ICD-10 CM coding guidelines, specifically related to the under-vaccinated of COVID-19. So our ICD-10 coding guidelines, section ICG-1N, the COVID-19 infection states, under an immunization for COVID-19 status, code Z28310, which represents our unvaccinated for the COVID-19, may be assigned when the patient has not received a COVID-19 vaccine of any type. We are to assign code Z28.311, which represents the partially vaccinated for COVID-19, and that may be assigned when the patient has been partially vaccinated for COVID-19 as per the recommendations of the Centers for Disease Control and Prevention, also known as our CDC, in place at the time of the encounter. So here I have included the link to the CDC's website, and on our next slide we will show you a screenshot of that. So here, as we're looking at the CDC's website, you'll see the different tabs here for your health, vaccines, cases and data, specific settings, and so forth. And so what we want to do when we go or click on the link for CDC, we want to look at the vaccine and boosters and see what the updated status is, or regulations or recommendations from the CDC as it pertains or relates to our vaccinations and immunizations. So here on section IB14 under immunization documentation, it states that the documentation by clinicians other than the patient's provider code assignment is based on the documentation by the patient's provider, i.e. the physician or other qualified healthcare practitioner legally accountable for establishing the patient's diagnosis. There are, however, a few exceptions when code assignment may be based on the medical record documentation from clinicians who are not the patient's provider. Again, that is the physician or other qualified healthcare practitioner that is legally accountable for establishing the patient's diagnosis. In this context, clinicians other than the patient's provider refer to healthcare professionals permitted based on regulatory or accreditation ICD-10 CM official guidelines for coding and reporting for the year of 2023, referencing page 16 of 118 requirements or internal hospital policies to document in a patient's official medical record. I will also add that clinicians could be, again, dietitians. It could be other medical assistants that are specific to the care of the patient. Okay, so according to ICD-10 CM coding guidelines for 2023, this is the listing of exceptions of clinicians as it relates to the documentation of ICD-10 or diagnoses for a patient's encounter or care. So these exceptions include codes for the body mass index, such as the BMI, the depth of non-pressure chronic ulcers, pressure ulcer stages, coma scale, the NIH stroke scale, social determinants of health, laterality, blood alcohol level, and in 2023 they did add the under immunization status of a patient. So in example 1, we're going to start applying the ICD-10 coding guideline to a particular scenario. So we have an 8-year-old patient who presented to the office with runny nose, cough, and a high temperature. According to the patient's mother, she has not been vaccinated for COVID-19. The nurse tested the patient and results came back negative. The patient was diagnosed with a common cold and was advised to increase fluid intake and take children's Tylenol for symptoms. So what code or codes should we assign? So what we have here, I underline our signs and symptoms and also underline the diagnosis. So in the event where the provider did not diagnose the patient with common cold, we are to assign the signs and symptoms as our diagnosis or diagnoses for the patient encounter. So in our ICD-10 CM code lookup, or as I like to call it, the drill down, for those of us actually using our ICD-10 CM manuals, we're going to look up our diagnosis code. So our first diagnosis code is the common cold, which was assigned or diagnosed by the practitioner for the patient encounter. So our code is J00, which represents acute nasopharyngitis and the common cold. So to look this ICD-10 code up in our ICD-10 manual, we must first identify the main term in the first diagnosis. So the main term in this diagnosis is cold. Acute nasopharyngitis and common describes the type of cold that the patient has. So once we identify our main term, we are then to drill down to what type of cold. And as I mentioned, or as we see here, the description or the type is acute nasopharyngitis common cold. And so once we drill down to common cold, it should take us to our ICD-10 code of J00. So here we're going to use the same methodology for our secondary diagnosis, which is the Z28.310, which represents the unvaccinated for the COVID-19. So again, we're going to identify the main term in the first, in this case, the second diagnosis. So unvaccinated or unvaccination, that is the main term. Most would think that COVID-19 is the main term, but COVID-19 doesn't tell us like exactly what's going on with the patient, right? So what is it about COVID-19 that we're identifying, or what is occurring with this particular patient encounter? It is due to the fact that the patient is unvaccinated for COVID-19. So unvaccinated or unvaccination is our main term. And so again, we're going to drill down to what type of unvaccination, because there could be an unvaccination for another diagnosis or another virus or another vaccine. And so COVID-19 is the specific type of unvaccination. And so once we drill down to COVID-19, it should take us to our ICD-10 code Z28.310. So in example number 2, we're going to use that same scenario. The only difference is that we're going to change it to the patient being partially vaccinated for COVID-19. So again, we have an 8-year-old patient who presented to the office with runny nose, cough, high temperature, and again, according to the patient's mom, she has been partially vaccinated for COVID-19. Her test did come back negative, and the patient again was diagnosed with a common cold. And the same advisement for treatment is again fluid intake as well as children's Tylenol. So what code or codes should we assign? So again, the same with the previous example, or example number 1, we're going to assign J00, which represents the acute nasopharyngitis common cold, and the same methodology that we utilized in that first scenario example, again, is identifying our main term, which is cold, and then what type of cold, which is common, and then we're going to go to J00. So here, as you can see, our diagnosis has slightly changed because now the patient is partially vaccinated, whereas in the other example or scenario, the patient wasn't vaccinated at all. So our ICD-10 code changed to Z28.311. However, we're still going to follow the same methodology of trying to locate our ICD-10 code in our coding manual. So, but instead, we're going to go with partial vaccination, right? What type of vaccination? Again, because there are other vaccinations, we're going to go down to COVID-19, which again represents the partial vaccination. And then it should take us to our ICD-10 code Z28.311. So here I took a screenshot of Codify, what it looks like on Codify. So when we type in our code of Z28.310, it does give us the related symbols and also provides us with a brief descriptor of that particular code, as well as give us some additional coding guidance as it relates to, again, based upon the documentation of that particular encounter. And so again, for those of you who are using Codify as your, I would say, ICD-10 manual or your source of reference, this is what it should look like, or what it would look like on Codify. And also just make note, for those of you who are coding in the inpatient setting, that there are some I would say some stop points here. For example, the present on admission diagnosis, this code should not be assigned. The code exempt from diagnosis, present on admission requirement, and then you primary diagnosis. So again, excuse me, principal diagnosis. So this is an unacceptable principal diagnosis for inpatient admission per the Medicare code edits or MCE. So here we also have some additional information from Codify. So for example, if you're looking for some additional information or resources, excuse me, that is specific to that particular diagnosis code, as you can see here, I took the liberty of giving you some arrows or directions to the AHA coding clinic as well as the CMS. And then there are some questions, maybe some most commonly asked questions by coders or providers, again, as it relates to the ICD-10 code. And as you can see here, we have a reader question. Is it necessary for vaccine administration encounters? We have incorporate these codes to track COVID-19 vaccine status. And these were posted at various times throughout the year of 2022. So what are the key takeaways from this particular tutorial? So our first one is you want to be sure to assign the ICD-10 code or codes for unvaccinated and partially vaccinated diagnosis correctly when it is documented by the provider or clinician per the ICD-10 coding guidelines. And you always want to make sure you code to the highest specificity. And then lastly, pay close attention to the additional coding steps located in your tabular list based on the documentation for further coding. Yes. So this concludes our tutorial on our 2023 ICD-10 coding guidelines for under immunization or under vaccinated for COVID-19. To learn more, please visit my website at www.abrahammedicalcodingcoachllc.com and be sure to follow us on LinkedIn at Abraham Medical Coding Coach LLC, as well as on Facebook. And also, if you're on Facebook, be sure to join our closed Facebook group to learn of coding opportunities from various healthcare employers. Be able to get your resume in front of those individuals who are hiring. And then also on Instagram at Abraham Medical Coding.